I'll be talking about the gap between those guiding programs from a system level and those implementing programs on the ground, and how this gap may be bridged from an Ontario perspective. So our purpose was threefold. So first, it was to understand what OHT participants found challenging about the system and policy environment. Secondly, we wanted to look at how system level participants responded to these challenges. And lastly, we wanted to understand what the perspectives and concerns of system level participants themselves were as it related to OHT implementation. So we collected data from November 2022 to February 2023, and the data are probably important because things have significantly changed since then on the policy end of things. And this involved interviewing 18 participants from both the system and OHTs. The 10 system participants included people from the ministry and from OH, which is the Crown agency responsible for the administration of Ontario's healthcare system. The cross-boundary stakeholders were people who didn't identify with either category or perhaps cross both in some way. So the questions we asked were guided by things that we had learned during the developmentalist evaluation, as well as a symposium and a webinar that was held soon after. So interviews were transcribed, thematically coded, and then analyzed. So here's some of the things that we gleaned from all of this. So OHT participants seem to be prioritizing local concerns over those of the health system. They tended to see themselves as separate from or in competition with the system. And sometimes they lacked an understanding of the limits of their own capacity and knowledge. As for system and policy participants, they were familiar actually with OHT concerns, but they were unable to respond freely and share their own concerns. And this could lead to OHT participants feeling like their system counterparts were divorced from on-the-ground concerns. They also seemed somewhat unaware that the motive behind chosen performance measures had been actually misunderstood by many, and that it was not enough for system-level stakeholders alone to know about future state. They also expected OHTs to understand the importance of identifying and filling knowledge gaps and generating value from within, without reiterating this need, without guiding the work required to get there. And they also lacked an understanding of the need to demonstrate the value of system structures and roles to OHTs. So these are some recommendations for OHTs. It'll be followed in the next slide by recommendations for system stakeholders. Perhaps they could, OHTs could develop an understanding of system level priorities and pilot initiatives, the rationale for why these priorities are actually prioritized. Perhaps you could develop an understanding of system level structures and roles. So the responsibilities and role scope of OH corporate versus OH regions. What are some available supports, system level planning tables? What are central program of supports that's available? What are communities of practice that they can perhaps take advantage of? Secondly, they might want to reconceptualize the relationship with the system from one of competition to cooperation. And one way to do this might be to invite OH representatives to OHT tables where possible. And they could develop a reflexive understanding of the limits of their own knowledge and capacity and develop a plan to address these gaps, possibly by tapping into already available supports where possible. So recommendations for system stakeholders. Okay, so start perhaps with building trust through communication and transparency with OHTs. So share plans where possible to mitigate OHT anxieties and as a reminder of end-state vision. Share information on how existing planning tables may inform OHT level work. Build even relationships with OHTs so that those that are not pilot sites don't feel left behind. And set clear expectations for what the system expects of OHTs and what OHTs can expect of the system. So reiterate expectations of value generation, clarify the purpose and the planned evolution of quality improvement indicators. Thirdly, demonstrate the value of system-level structures, supports, and roles to mitigate confusion about responsibilities. And again, encourage the meaningful embedding of OH at OHT tables. both work with OHTs to identify and address gaps in knowledge and capacity, monitor the needs of OHTs with contextual factors that affect capacity building, things like being an indigenous or rural OHTs, and this can be part of an equity-driven approach. And finally, establish or endorse common supports that OHTs can systematically draw upon with confidence that they do, in fact, have system approval and cross-OHT applicability, so they won't be expected to change the way they're doing things, 4 to 5 months down the line.